What's up guys, it's Elliot here from MMT, here with Ninja.
Hello.
Today we're going to talk about quads, quad dominance and its relation to issues like knee pain, thigh pains and sitting. So everyone knows the quads there, 4 muscles, quad, 1, 2, 3, 4. You got your VM, which is the inner thigh muscle, your VL, which is over here, which rides underneath the ITB. And then you've got the 2 in the middle there, so vastus intermedialis, which is the deep quad muscle, and then you get your rec fem on top of that. We're just going to focus on 2 major ones today, which is the VM on the inside and the VL on the outside there. So quad dominance is basically when people, when they're standing or when they're walking there, use a lot of their quads for the kind of squatting motion. And that comes about because of the loss of control in our hamstrings and our glutes there. As we all know, that can come about from sitting or sedentary lifestyles. So when you're sitting for long periods there, you're basically squashing this part of your body, so blood flow is not going to get into that area there. The muscles, the nerves, all that kind of stuff there, they're not getting fed the blood supply. So then when the person sits for a while and they go to get up there, that muscle's not going to be active, but you're not going to topple over. The body's very smart, it starts to compensate. And it does that by recruiting the quads on this side to hold you, to stop you from falling over. And then that becomes your pattern. So if your lifestyle is one that where you're squashing this part of your body quite a lot there, this part will go to sleep and this is going to take over. So the key to that is obviously to monitor your sitting time, trying to get up more often, trying to get more blood flow into this area and then start to load that area. So going to squats, squat holds, doing hip thrusts, hip extensions, just trying to get activation happening in that area. That's the big fix for that. But what we're going to do today is look at what we'll do to address the dominance in the quads there. So a lot of times when these become shortened and over-contracted, they no longer will have the ability to maintain suspension and be able to hold the weight there. And so that weight has to go somewhere, and for a lot of people it goes into their knees. So these people will usually complain about, oh, I get some knee pains, especially when I go downstairs. And as they step down, their knees feel creaky and quite achy. And it's because all this has started to solidify and the load is being borne through here. So if that's you, have a think about it. Think about how tight your quads might be, how weak your glutes might be, and we can start to get into that. I find that this sort of presentation often gets misdiagnosed as something like knee arthritis because you can get pains coming in from the tendons here or from the kneecap there, not so much from the joint there. All right, so how we want to start to work on freeing up the tissue here and get it being more ready to be recruited as part of that suspension system again is address the tightness there. And some people will get quite tight in their VMs. So Ninja's not too bad. But what I do is I sort of find like that termination point of that VM and just start there.
Yeah, it feels therapeutic on that tendon.
And so that muscle there, where it finishes in there, it shortens when our knee's in that extended position, which is quite a lot of us when we're up and standing there. It lengthens and stretches out when we're kneeling and having this leg pulled back there. So if you think about, if you were to rate how many times in a day your leg would be in this position versus that position, you see that the balance of it would be more towards this position here. So you'll get a lot of shortening there. So a good exercise to help retrain this area to get more length into it is the sissy squat, which is kind of like where you squat knees over toes, leaning back and going down into that position. So that creates recruitment of the quads while it's lengthening. And that's probably a bit more effective than just trying to stretch your quads. How am I going there?
It's good, feels good. Therapeutic.
Excellent.
Yeah.
So you can play around the position when we're working with this. A warm-up stroke would basically just want to feel that lower portion of the medialis muscle, especially like someone's been doing a bit of running or weights as well. They can be recruiting quite a lot of this. So I want to get into it there. You can lengthen it a bit by putting the knee into a bit of flexion, so it starts to create a bit of length through there. And then we can go into our second stroke, where I like to use my thumb a bit more.
Yeah, it's good.
Yeah, so a bit of a twitch there. Wait, there
That
we
one.
go.
Yeah, feeling that. It's money.
So we've got a bit of a money spot situation happening here. As I finish my stroke through here. Gonna just dab a little bit more wax so I don't burn the skin too much. So I find that treatments like this is a bit of a 2-for-1. I'm getting a nice release of that muscle, but I'm training a bit of my thumb strength and my grip strength. And I like to rise up to that challenge.
Good.
Yeah, one thing we get complimented on as therapists is having strong hands and strong thumbs.
Yeah, you got them. It's good, mate.
Yeah, so you'll see a bit of quivering and reaction from the rest of the quad there because we've hit a dense spot.
Good.
And oftentimes, for those of you who do a bit of foam rolling, this is an area that you can focus in on rather than just roll your thigh over the foam roller there. You can turn your foot out and get the thigh to roll over the roll on the inner portion of the thigh there, particularly if you've got a hard roller. When I say hard, I don't mean those spiky ones, I mean like a firm, like almost like a PVC type of surface. And that ensures that you really get down to the depth that you really need to be therapeutic. Because think about it, this is a thigh, it's got this certain size to it, but there's a femur that runs through the middle there, that's the bone. So I've all seen that kind of bone there. And there's all this between the skin and the bone, there's all this tissue in between. So when you're doing your foam rolling and self-release there, just try to sink into it, try and think about contacting that bone deep inside.
It's good, mate.
And so it looks like I'm in the middle of the thigh there, but what I'm actually doing is pinning the inner thigh muscle, the VM, and pushing it into the femur itself there. So if I go back into this position, it's here, but I've kind of collected it, grabbed it, pulled it across, and then pinned it in.
Mm-hmm.
And so trying to get contact with all its attachment points along the femur as well. Thinking about stretching those fibers. So even though I'm pinning it, I'm pushing it across so the fibers there stretch across like that. That helps to get some more separation in some of the tissues there that may have been stuck over time. Okie dokie. So that's the inner thigh. Now we'll do the outer thigh. So people talk about rolling their ITBs and the lateral quads there. The ITB is a thickening of your thigh fascia, right? So you can sort of feel it on yourself as well when you touch your own leg. There's that band of tissue through there. And so this also needs to be quite mobile. You can't stretch it. It doesn't have much give. It's not like muscles which can move a lot. It's basically thickening of tissue there. But what we want to do is when we roll on it or work through it is to help the hydration of it. So the ITB itself is not a muscle. It has a muscle attached to it at the top there, which is the TFL. But the thickening of the fascia there lies on top of your vastus lateralis, your lateral quad there. And so we can also help the stickiness of that. Right, so same thing as what I did before. Just put a little bit of wax again. So I might just get another towel. Bolster this up a bit. So I want a bit of knee flexion there so that way it's not all short. And same thing again too. So I can feel the ITB tendon here. There's that tough flicking thing there. So I'm going to skip past that and just work into the lateral quad. Okay, so the quad muscles as well, this whole area of muscle here terminates down into what's known as the quad tendon. There's a quad tendon here, and that tendon is connected to your patella. Yeah. Following on from your patella, you have another tendon called the patellar tendon, which goes onto your tibia here. So it's all this continuous connection point down through here. And so if you have a dysfunction or problem with any part of this system here, you're going to have a problem with the shock absorption through those tendons, as well as the ability of that kneecap to slide evenly. So some people will get diagnosed with patellofemoral pain syndrome, which is usually simplified as like your kneecap is off track, it's grinding up against the bone. Not necessarily true. The reason why it's called a syndrome is because it has a collection of symptoms. It doesn't have to be grinding, it could just be holding too much weight or too much pressure into one portion, like the tendon itself or in the quad tendon there. For some people, it's even the fat pad. You get some fat pads behind the tendon here, known as the Hoffer's fat pad.
Yeah.
Yeah, it's good.
Yeah, money.
So you start to see
Money spot there, mate.
some reactivity. Yeah.
It's good. Yeah, you're on it.
And it's just going to be patient with what you feel underneath there, trying to keep contact with those bounded up areas. And here's quite good because we can actually see the delineation of the ITB with the quad. So I'm actually treating the muscle here, going along its length, and not just squashing the ITB. ITB's got a lot of nerves in it too, so you just squash it. You can aggravate a little bit, get some referral pains into the knee. What we're trying to do here is restore movement, restore hydration into this area.
Doing good.
Yeah, so you can imagine there's a lot of people, maybe yourself, you'd feel that this region doesn't get its motion all the way throughout the day. So there's a good chance that it'll start to bind up and get quite tight, especially people getting into running. They load this area up quite repetitively, which is fine, which is what it needs, but sometimes it can be overdone and start to stiffen up. Something else I wanted to do with this, what was it? Oh yeah. So if you've seen some of my other videos, you've noticed I've used like a pinch technique on some muscles. And so something else I've been exploring as well is this region here, how we can actually grab it.
Whoa.
Like that.
That's good.
And you'll start to see it flick like this. So some money spots, you almost have to like bring them away from the bone and crush them.
To pin it, isn't it?
Yeah.
Another way of pinning it.
Just on itself like that. Sometimes I find myself doing this in the sauna, grabbing my own lateral quad and just squeezing into it like that. Juicing the muscle.
That's it. Needs juice.
If we just rotate this way a bit, so just trying to think how I do it. Maybe I go from this way.
Yeah, it's good, man.
Just make sure we get enough support. So we take the tension off. Same thing again. So now I'm focusing this whole lateral portion there. I'm grabbing a good amount and then just squeezing into it like that.
That's it.
Yeah, and then you can sort of see those areas there. Oh, sorry. There we are. So, great way to find some trigger points as we're applying pressure. But yeah, if someone's got a lot of quad dominance, you're going to start to see this because This region's been recruited a lot, holding a lot of the weight, taking the work away from the glutes and the hamstrings. So lactic acid, a bunch of waste products start to collect up, bind up, and the region gets quite stiff. So we're releasing those products, desensitizing the nerves, getting motion back into the tissues there, rehydrating it. That's one step to addressing all this. But of course, it's not worth doing unless you address the big problem, which is how much you're sitting on your tushy.
Yeah.
You know,
The cause.
get down to the root cause.
Whoa. It's good. You can tell this is going to help. It's going to fix it. I think one of the key words you said was hydrating these muscles, you know, the fascia, the real thick fascial bands, you know, the tendons. Yeah, that's where you get health. Yes.
That's always a battle, isn't it, of gaining water and losing water in our bodies. If you think about how much of your body is actually water and how much you take in versus how much leaves your body, most of us seems that more leaves than we take in. Through sweat, through urine, through your breath, you're breathing out water all the time.
Even off your skin, yeah.
You know, but the funny thing is your brain, your guts, they have to be at a certain amount of hydration to function even. And so your body is very smart. It starts, if it doesn't get enough water from outside sources, it starts to pull water from other parts of your body to make sure these vital areas get enough water. So over time, these areas so we can maintain water, but other areas which are deemed not as important as these lose their hydration. So look at a kid, it's a ball of water. As a person gets older, that person's tissues, all that stuff starts to dry out and become more of a husk.
They're a prune.
Yeah. So yeah, drink more water, but obviously look at things that are dehydrating you. So that's like your alcohol, your coffee, your sugars, your salts. You know, having things in the right amount of moderation to make sure we get that balance right. And our body, when it senses there's too much of these toxins going in, like too much salt, too much sugar, too much alcohol, what's it going to use? It's going to use whatever water it has to flush it out. Alrighty, so that's how we treat some quad dominance. Have a look at some of our other videos, especially the ones with training our glutes, activating the glutes, getting to those squat holds. If not, come in here, talk to one of us, and we'll treat you, but also get you moving again.
Yeah.
Done.
Good advice. Done.